Okay, now it's time for me to go through and explain this oxyhemoglobin dissociation curve. First, down here, the x-axis is showing you the PO2, that means partial pressure of oxygen. And down here, you are seeing that when blood first enters arteries, or say blood first enters the arterial side of a capillary, the partial pressure of oxygen is 100 millimeters of mercury. And when blood leaves a capillary and enters a vein, that partial pressure has dropped to 40. On the y-axis, you're seeing the percent of oxygen that is bound to hemoglobin. If there is one oxygen bound, it would be 25%. Remember, there are 4 molecules of oxygen that bind to a molecule of hemoglobin. If there are 2 molecules present of oxygen, the hemoglobin would be 50% saturated. If there are 3, then the hemoglobin would be 75%. And if there are 4, then the hemoglobin molecule is 100% saturated. This x-axis of PO2 and y-axis of percent saturation are your typical x and y axes for an oxyhemoglobin dissociation curve. This curve in front of you has an added y-axis, and that is oxygen content. Oxygen content includes dissolved oxygen that's dissolved in your plasma, and oxygen that is carried. That means bound to hemoglobin. Significantly more oxygen is carried by your red blood cells than the oxygen dissolved in your plasma. In fact, the amount of oxygen dissolved in your plasma is about 0.3 milliliters for every 100 milliliters of plasma. How much oxygen is carried in your red blood cells? Well, that depends on how much hemoglobin you have. Remember, on an earlier slide, I told you about hemoglobin grams percent. The amount of hemoglobin in 100 milliliters of whole blood. For every gram of hemoglobin, you get 1.34 milliliters of oxygen carried. A typical hemoglobin grams percent is 14 to 16 grams percent. So if I multiply 15 by 1.34 milliliters of oxygen for every gram of hemoglobin I have, I'm going to get close to this 20 milliliters per 100 milliliters of whole blood. The added 0.3 from dissolved oxygen in the plasma is insignificant compared to that carried. Still, knowing oxygen content is an important y-axis to see on this oxyhemoglobin dissociation curve. Now let's look at what happens when a red blood cell travels through a capillary, when it travels from the arterial end to the venous end. So I'm writing down the word capillary here. And the question is, how many molecules of oxygen will come off of the hemoglobin when this partial pressure changes? Well, if you look up here, when the partial pressure is 100, we draw a vertical line up and then a horizontal line over. We're close to 100%. This graph is a little misleading. It's actually closer to about 97%. We're never at 100%. And here's the reason why. As soon as red blood cells leave the pulmonary capillary beds, there are other tissues that the red blood cell will travel in close proximity to, and some of those tissues will be taking some of the oxygen. So it really should be closer to about 97%. As the partial pressure drops down to 40 millimeters of mercury, at the venous end of a capillary bed, if I draw my vertical line up and then horizontal line across, we see that one molecule of oxygen has left the hemoglobin molecule. The hemoglobin molecule is now 75%. So going from 100 millimeters of mercury partial pressure, shown here with this blue dot, down to 40 millimeters of mercury, we have lost one molecule of oxygen to the surrounding tissues. Now, we could ask ourselves, what was the partial pressure difference? What was the change in partial pressure that was required to lose this one molecule of oxygen? Well, 100 minus 40 is 60 millimeters of mercury. Similarly, we can go in the other direction. When a red blood cell is traveling through the pulmonary vein on its way to a pulmonary capillary for gas exchange, it would take a 60 millimeters of mercury of pressure change going in the other direction. This is called loading in the lung capillaries. What if we wanted to ask the question, how much of a pressure change would be required to go from 75% to 50%? Well, here's my 50% saturation. I'm going to draw a horizontal line until I hit my sigmoid curve. Then I'm going to draw a vertical line down. And to lose another molecule of oxygen, that means going from 75% to 50%, we would have to go from 40 millimeters of mercury down to about 30. That's a difference of only 10 millimeters of mercury to lose a second molecule of oxygen. That is what I meant by the slope of this sigmoid or S-shaped curve, showing us that not all molecules of oxygen load nor unload with the same affinity, they all require different partial pressures to either load or unload. This is what we mean by allosteric interactions. Something is changing in one part of hemoglobin that affects the other parts. One globin chain with its heme group losing one molecule of oxygen requires a big difference of partial pressure, a change of 100 to 40 millimeters of mercury. That's a difference of 60 millimeters of mercury. But then the second one to come off from the second globin chain only required a difference of about 10 millimeters of mercury. What about going from 50% saturation to 25% saturation? It looks like approximately, again, another 10 millimeters of mercury. What about going from 25% down to 0% saturation? Well, that's a difference about 20 millimeters of mercury. Earlier, I said that getting the first oxygen to come off requires a huge amount of pressure, partial pressure of oxygen difference, change. Getting the second and third are easier, and removing the last oxygen is slightly higher or harder. Not harder than the first, I said, but harder than the third. And we see instead of 10 millimeters of mercury, it's roughly 20 millimeters of mercury. I want to take some time and tell you again that a lot of oxyhemoglobin dissociation curves do not show this y-axis of oxygen content. Most of them only show the x-axis for partial pressure of oxygen and the percent saturation for oxyhemoglobin. The reason why I think it's helpful to have this oxygen content y-axis is to remind us that a person who is anemic, A person who has a lower oxygen carrying capacity, that is the definition of anemia, could have a hemoglobin grams percent of 12 milligrams percent. If there is nothing wrong with that hemoglobin, if it could still bind to oxygen and unbind, a reversible reaction, then their percent oxyhemoglobin saturation would still be the same values, 0 to 100. You see, the x-axis and y-axis shown here for PO2 and percent oxyhemoglobin saturation tells you nothing about the person's hemoglobin grams percent. But the other y-axis that shows oxygen content, shown here, is showing you a normal oxygen content, assuming a normal hemoglobin grams percent of 14 to 16. You might appreciate how this y-axis on the right would change if it were a person with 12 milligrams or 12 grams percent of hemoglobin. That should be grams, not milligrams. Sorry, 12 grams. It would be different. It wouldn't reach all the way up to 20. So you need to really pay attention to those x and y axes. The x-axis never changes. The traditional y-axis is to only show the percent saturation. Only a few oxyhemoglobin curves actually include this oxygen content. And again, in this picture, it is assuming a normal hemoglobin grams percent. Again, that should not have read milligrams on my slide, but instead hemoglobin grams percent of 14 to 16 grams percent. Again, that sigmoid curve suggests an allosteric interaction. This means there is communication between each globin chain and its heme group. Not only is there communication between each globin chain and its heme group, but there's also communication between the adjacent globin chains with their heme groups. How is this possible? Globin chains are rich in amino acids. Specifically, that's what they're made of, but specifically there's one amino acid that is particularly noteworthy, and that's histidine. Histidine is capable, due to its chemistry, this imidazole group, it is capable of binding to both hydrogen ions and carbon dioxide. Maybe that surprises you. Hemoglobin carries more than oxygen. Hemoglobin can also carry hydrogen ions, think acid, and carbon dioxide, one of our waste molecules, our gas waste from cellular respiration. CO2 is also considered to be acidic. You will learn more why CO2 should be thought of as acidic when we get to our acid-base balance lecture later on in the semester. Until we get there, please trust me that CO2 in your body is considered to be a mild acid. Certainly CO2 in our environment, we think of acid rain, is also acidic. So if hydrogen and CO2 can also bind to these histidine residues on the globin chains, and oxygen binds to the heme groups with the iron, we're going to see that when hydrogen and CO2 are bound to histidine, this will affect the ability of oxygen to bind to the heme group. This is an allosteric interaction. Changes to one part of a molecule are affecting the other. Similarly, if oxygen is bound to hemoglobin, then the hemoglobin's affinity for hydrogen and CO2 will also be affected. You see, it goes both ways. If hydrogen and CO2 are bound, Hemoglobin has less affinity for oxygen. It's more likely to let go. But if hydrogen and CO2 are not bound to the globin chains, are not bound to the histidine residues, then the heme groups have a higher affinity, greediness, want to bind to oxygen. Let's look at this in more detail. Let's look at this allosteric interaction on a more molecular level and go through some more examples. On the next few slides, we're going to delve into more of this allosterism, these allosteric interactions. And I'll be talking about shifting in the hemoglobin, oxyhemoglobin dissociation curve. These curves can shift either to the left or right. They still will maintain their S-shaped appearance, but the slope will shift either to the left or right. These shifts reflect changes in hemoglobin's affinity for oxygen. A shift to the left will mean that hemoglobin is more greedy. It holds on to oxygen. Its affinity increases. A shift to the right means hemoglobin holds on to oxygen less tightly. Hemoglobin's oxygen affinity decreases. Let me explain why this affinity changes, and then I'll tell you my analogy for this. In this picture to the right, you are seeing globin chains. You are seeing the amino acids. In blue, you're seeing the amino acids coiled in a helical shape. And then you're also seeing in red, and I'm using opposite colors so that you can see this on the picture. In red, you're also seeing the globin amino acids in a helical shape. These are the amino acids that are interacting with iron. And you can see iron down here. And it's in its heme group. This heme group would be going all the way around. So I should say it's the porphyrin ring. I'm just going to abbreviate it. Por ring. So heme, remember, is the porphyrin ring and iron combined. And you can see right here that oxygen is interacting with that iron that's in the center of the heme group. You can also see here that histidine amino acids in the globin chain in this helical portion are interacting with iron. It's as if saying histidine cannot interact with too many things at once. Histidine can either focus on iron and oxygen, or it can focus on carbon dioxide and acid, hydrogen ions that I mentioned previously. And there will be other examples. Just give me a moment, please. This tilting that you're seeing between the blue helical chains and the red helical chains in this picture are not showing you different amino acids. It's just showing you positional changes. They are the same amino acids. They're just changing conformation state. Very similar to you adjusting in your chair as you're listening to me right now. Maybe you need to sit in a different position. So that's called a conformational change. When there's a conformational change in these globin chains, there is also a conformation change in the positioning of iron in this porphyrin ring. I like to think of it a lot like a child jumping on a trampoline. I think of the child as the iron center and the elastic portion of the trampoline as being the porphyrin ring. And the child can be up or down. If iron is up, we say it is in the tensed position. If iron is in the relaxed position, iron is down. When iron is in the tensed or up position, it does not bind to oxygen well. The affinity for iron toward oxygen decreases. Again, when iron is in the tensed or up position, it does not hold on to, it has a lower affinity for oxygen. That means it will release oxygen. When will iron release oxygen? To tissue beds, tissues that are metabolically active and require oxygen. When iron is in the relaxed position or, quote, down position, then iron has a higher affinity for oxygen and will bind it. When do we see that happening? When a red blood cell is traveling through a pulmonary capillary bed. Iron would be in the relaxed position. The question now becomes, when, how does iron get in this up or down position? And again, I urge you to look at this interaction that you're seeing with iron and the histidine residues of the globin chains. Something is going to happen to those histidine residues that's going to make those globin chains change position and in turn pull on iron or not. And if iron is in the tensed position versus relaxed position, as the iron moves downwards, it pulls the attached histidine and the helix downward as well. This causes hemoglobin to switch from the tensed to the relaxed state. Relaxed state means iron can bind oxygen. When oxygen binds to the iron, the heme changes from a dome-like to more of a planar conformation, meaning pulling the iron downward. Relaxed, downward, conformation state changes. Iron can now bind to oxygen. If something makes the iron move upward, shown here in red now, if iron moves upward, we're going to see, if iron moves from the downward shown in red to upward state shown in blue, it is now going to be in a tensed position. Iron in an upward state is not going to have a high affinity for oxygen. Allosteric interactions. Changes in one molecule can affect other parts of the same molecule. We're going to see that there are four natural physiological changes that can affect the affinity for hemoglobin, iron in particular, through the globin chains and the histidine residues to bind to oxygen. These four natural changes are pH, think hydrogen ions, acidity versus basic conditions, CO2, a waste molecule, a waste gas that I told you to think of as slightly acidic. Number 3, temperature. And number 4, a byproduct of anaerobic respiration in red blood cells. This byproduct is called 2,3 BPG, B as in boy, P as in Paul, G as in girl, or 2,3 DPG, D as in dog, P as in Paul, G as in girl. Let me go through these 4 changes one by one. In red, here is our normal sigmoid curve. We see a green sigmoid curve and a blue sigmoid curve. The green sigmoid curve is shifted to the left. And again, you're looking at this graph. So when I say shifted to the left, I mean your left. The blue sigmoid curve is showing you a right shift. Right shift means less affinity. Left shift means greater affinity. How can I prove this to you? For demonstration's sake, let's say we want to go from 100%. And remember, from an earlier slide, I told you that it's really not 100%. It's closer to 97%. But still, I want you to think of 100% and 97% as being our normal. We're going to go from 100% to 50%. So we're going to go from 100%, 97%, to 50%. Again, this is just for demonstration. Across a normal capillary bed, as I showed you before, we only lose 1 oxygen molecule out of the 4. In a normal capillary bed, we would only go from 100%, 97%, to 75%. But for this demonstration, just again, I think it's cleaner, it's easier. It's easy to see 50% as being halfway between 60 and 40%. And what I want you to do is draw, I should say, a horizontal line through all 3 curves. The red, which is normal, that's in the middle. The green, which is on the left, and the blue, which is on the right. Now draw vertical lines down. Excuse my lack of drawing a true vertical line. However, I'm trying to draw on my PowerPoint slide using a stylus on a screen that's tilted. So forgive me. If we look at the blue right shifted curve, we see we only have to go from, and I'm going to write in blue, we only have to go from 100 to 40, which is a change of 60 millimeters of mercury, to go from 100% saturated to 50% saturated. But for the normal curve to go from 100% saturated to 50% saturated, we would have to go from 100 millimeters of mercury down to 30, which would be a difference of 70. For the green shifted, a very high affinity hemoglobin, a very selfish hemoglobin, we would have to go from 100 millimeters of mercury, a partial pressure for oxygen, down to about 21, 22. That's almost an 80 millimeter of mercury worth of pressure difference to shift. Now here's my analogy. My analogy is a toddler analogy. What do I mean by that? Well, I have two pretty much grown children now. But when they were little, they loved getting presents, especially during the holidays. And I would give them, especially my oldest. My oldest is the same age as one of my nieces. And so they were born 6 months apart from each other. My niece, when she was a baby, let's just say she was not a very nice girl. She was very demanding, even as an infant she was. So I would give my oldest son his Christmas presents. And when I realized that my niece would be coming over, she had this personality where she thought everything was hers, even as a young child, an infant, a toddler. In an effort to make sure that she did not demand that everything was hers, I would take away my son's presents and hide them. Now, you try and explain to a toddler why you're giving them a present and then why you're taking it away from them. They do not understand. So I want you to think of a left-shifted hemoglobin like a toddler. That's why I wrote it in green. It's very easy to give a toddler a present. You can say, I have a present for you. And before you even say, I have a present, and you're handing it to the toddler, they will grab it out of your hands and have it opened. You see, it's very easy to load a present to a toddler. They have a high affinity for presents. They love gifts. Try and take it away. Oh boy. That does not go over well. You will have to pull very hard to get that toy, that present, that gift away from the toddler. You see, a left-shifted hemoglobin is a very greedy, toddler-like hemoglobin. Getting it to load, getting it to go from 50% to 100, to go from 50% to 100, or roughly 97, you would only have to go from about 22 millimeters of mercury up to about 70 millimeters of mercury. You don't even have to go up to 100. It's easy to load. So left shifted. Easy to load. Hard to unload. A right-shifted hemoglobin is like trying to give an adult a present. Oh, no, you're too generous, they say. No, you keep it, you need it, you have it. And try as you might say, well, I saw this at the store and I thought of you. It just makes me happy to give it to you. Please let me give it to you. And if you look here, going from 50% to 100, loading, trying to give the present of oxygen. For the blue curve, shifting from 50% to 100%, we're at about 60 millimeters of mercury. For normal to go from 50% to 100%, for normal, that would have been a shifting of going from about 30 millimeters of mercury to about 100, almost 70 millimeters of mercury. We can look at these oxyhemoglobin dissociation curves as a loading perspective or unloading. What kind of hemoglobin are we trying to load or unload? Are we loading or unloading a toddler? A toddler loading the gift of oxygen? A left-shifted hemoglobin? Easy. You don't have to influence that toddler hardly at all. Hey, I got you a present. Boom, they grab it. Unloading, they don't understand why you're taking the present away from them. What about a right-shifted hemoglobin? That's a lot like an adult. Trying to give an adult a gift. Trying to get them to accept your gift graciously is very challenging sometimes. You really, no, I got it for you. You have to push it on them. I got this for you. Will you please take it? To unload it, very easy. Normal is in the middle. Normal is what I showed you about 5 slides ago. So this is for pH, hydrogen ions. And remember, I told you that hydrogen can bind to the histidine residues of any globin chain.